My name is Dr. Tina Chu and I'm a veterinarian specializing in home services in the heart of Toronto, Ontario and surrounding areas. Welcome to my home and to a series of talks put together to assist you in establishing a lasting, happy and healthy bond with your pets. Today's an exciting instructional video on how you can perform a physical examination on your pets all in the comfort of your own home. It's important for us to learn the basics of what's normal in our pets, so it flags our attention to things that may seem concerning to us, where we do need to seek professional advice from our family veterinarian. We take our pets to see our veterinarian once or twice a year for their physical examinations, and that's important. Learning how to conduct an at-home physical examination does not take the place of these formal vet visits. What it's meant to do is to complement the vet visit so that you'll find it will increase the accuracy of the vet visit from your physical examination findings. It will help to create more structure and organization during your appointment, and it will also help to increase the appointment flow of the vet visit too. If your pet experiences any vomiting, diarrhea, very lethargic, so seeming tired, isn't really interested in eating food, having difficulty breathing, there's bleeding anywhere, anything that seems urgent, please seek veterinary assistance immediately. On our company website at www.tomobilevet.com, there are printable PDF physical examination forms that you can print off and fill out. Not only are they helpful to help you go through a list of body regions that you should be examining, but once you fill them out, what's great about them is that you can send them to your family veterinarian for review, maybe a few days or a week before a scheduled veterinary visit. Not only will your vet be impressed, but it will also help jog your memory as well as focus the appointment to concerns or questions that you may have had during the months that you've done your at-home physical examination. In a separate video, I will show you how to fill out these forms and how they may be of use to you. A physical examination on your pets, either by your veterinarian or even by you, is important in our pets' health. And the reason being is a year in our years is equivalent to 7 years in their years. So if you've picked up something that is of concern and you are finding it that you might need to book an appointment sooner than a 6-month scheduled visit that your vet has made, it may alert you to contact your veterinarian sooner to book those appointments. Our family veterinarians do a great job of reminding us to book a biannual or annual physical examination, and those are important formal examinations. They're mainly as a screening tool to make sure that your at-home progress with your pet is going well, there's no questions or concerns on your end, and your pet on a physical exam standpoint seems healthy too. The health of our pets and happiness really depends on the team effort between your family veterinarian and pet guardian. Because our pets don't have a voice, it really is a matter of being able to communicate with each other, because the pet guardian may pick up on subtleties that they're finding over the course of months that are important to address at the actual appointment. And the veterinarian is picking up any objective things that may be of concern at the appointment, and together, when we communicate that across, we'll be able to generate a plan of care that is appropriate to ensure the quality of life is maintained or enhanced in our pets. So now we're ready to do an at-home examination on our pet. The first thing you want to do is find a quiet and calm place and time of day where you can conduct a physical examination with focus. And we can conduct the physical examination in 10 easy steps. The first 2 are more observational, and so the first step being to assess the emotional state or the daily routine of our pets. So my kitty Rolly here, as an example, loves to eat his morning meal, will wake me up at 4:30 in the morning as usual, patting my face, wanting me to feed him at that time. His behavior of eating his food is he'll leave a few crumbs in his dish, and that's normal for him so that he can go back and munch on them a little bit later in the morning. And paying attention to his daily routine. He loves to purr and rub his face against objects. He loves to play with his favorite ball. He always goes poop and a pee in the morning, which is normal for him. So that's something important to document. The second part is to watch their gait, so their ability to move around in the home. And Rolly is quite an acrobat. He loves to jump up on this high shelf in my washroom. I don't know how he does it, but he does it every day without any difficulty. He doesn't have any issues with walking, so that's a good thing. He's not lame or limping on any of his limbs. So the next 8 steps of the physical examination is more hands-on, and we're going to start by body region from the tip of Rolly's nose to his tail. So the first body region is going to be the head and face, and the things that we want to pay attention to are the eyes, nose, and the mouth. So starting with our pet's eyes, we'll notice that they should be open. They shouldn't be closed shut as if in discomfort. There's no swelling around the eyes or redness. You want to note the discharge of the eyes. There shouldn't be excessive tearing, yellow or green discharge. If that's the case, it may signify infection. When playing around with our pets' eyelids, pets have very mobile skin, so don't be afraid. And what you want to do is pull the eyelids up a bit to see the sclera, the white part of their eyes, just to make sure it's not red. And sometimes when you're doing that, the third eyelid can come up. So dogs and cats have a third eyelid that can come up when you're pressing down on their eye or manipulating their eye, and that's normal, but they shouldn't be staying up when you are manipulating their eyes. If they are raised and they consistently are raised and not going down, that could also signify an infection of the eyes or pain or discomfort. The other thing you want to pay attention to is the pupils. So cats have slit-like pupils and dogs have more round pupils, but they should be symmetrical on both the left and right sides. The next thing is, well, you want to look at the nose. So look and make sure that the nose isn't dripping wet. There's no yellow or green discharge that may signify an infection. That the nose is nice and moist, not too dry or wet. There's no cracks on the nose, and Rolly's nose is nice and pink and moist. It's good. The other things you want to do is check the ears, make sure that they're nice and clean. There's no redness, scratches on the outside that may signify an ear infection. You can smell them. So Rolly's ears have no smell. If there's like a foul odor, it may indicate an infection of the ears. The final part of the head and face examination is to look inside the mouth. And although this is important to do, it's important to note that do this at your own pace. It's easier to do this on your kittens and puppies because they're not, they can get used to it a little sooner or quicker than our adult pets. But you can still do it on our adult pets. It just means to be more patient and go at your own pace. So what you want to do is maybe for your adult pet, just maybe start rubbing underneath their chin or their cheeks because they love that, and see if eventually you can stick your fingers in just around the sides of the mouth without any concerns. But eventually what you want to work your way to is with one hand, you want to just, you can see that Rolly and dogs and cats have canines. You want to just take your middle finger on one hand and the thumb of the other, put them behind the canines and hold up the lip. And the other hand, you want to take the finger and pull down on the bottom part of their jaw, just where the incisors are, to look inside the mouth. And what you want to do is smell the mouth, make sure it doesn't have a foul odor. If you can, lift up the gums to make sure that his gums are nice and pink, that there's no infection of the teeth, they're nice and white, there's no bleeding inside the mouth or any abnormal bumps or growths. The next region that we're going to be looking at is now the neck and throat. So just feeling along the sides, making sure there's no scabs, no abnormal bumps. But just like in us, people, we have an Adam's apple. So this is a normal structure to feel. So just along the windpipe in the middle, you'll find a little bump, and that's normal. That's an Adam's apple. The next thing you want to do is take a look at the forelimbs and the fingers. So you just want to be able to press each toe, making sure that you're taking a look at the nails, that they're not too long, they're growing into the toe pad, there's no pain or anything like that. And on average, cats will have 5 fingers, and and 4 toes. Dogs on average have 4 to 5 fingers and 4 to 5 toes. So just making sure you feel all of them. Feel their arms, making sure there's no pain or no tight muscles there. Okay. After that's completed, you want to gently massage the back. So Rolly loves this part, and I'm just massaging the back, making sure he's not tense anywhere. If he stops his purring, because my cat's a purrer when he gets his massages and pets, then I might know that he's uncomfortable there. Okay, so he should feel comfortable when I'm touching his back, and that's good. The next part is to feel his belly. So when you're touching his belly, you can take one hand and just place it underneath the belly. Just have a light massage there, making sure it kind of feels like a soft water balloon a bit. If there's any tension, if Rolly starts to have any vomiting when I'm touching this, or there's some concern, then you'll know that that's not a normal finding. But it should feel nice and soft, and he's letting me do it without any issues. Next, you want to look at the hind toes and the hind limbs. So again, taking a look at all the toes, making sure the nails are nice and short. There's no pain or anything when I'm touching his legs. Okay, and you want to do the other side as well. He's not seeming to mind this. He likes it. Next, you want to check the tail and the rear end. So with your hand, you want to just feel along the tail, make sure there's no bumps or lumps or anything like that. You want to check the back end, making sure that things are okay there. You might want to flip him on his belly like a baby just to check his groin region. It's nice and clean. He's okay, right? And then the final part of the examination, step 10, is to check the skin and coat. So making sure you just kind of pull the fur backwards to make sure the skin underneath is not flaky, reddened. There's no bumps or scratches anywhere. And everything looks good there. There's no mats or knots in the fur. It's relatively healthy, and that completes your physical examination. Thanks, Rolly. Thank you for watching this video. I sincerely hope it was helpful to you. There are printable PDF handouts that are more detailed, as well as the printable PDF physical examination forms on our company website at www.tomobilevet.com, so be sure to check it out. If you have any specific medical questions or concerns about your pet's health, please contact your family veterinarian for further information. Thanks again for watching. I wish you all a wonderful day, and we'll see you all again soon. Bye for now.